and we have a fentanyl explosion.
The fentanyl crisis is real if you ask Cam Strom, Assistant Special Agent in charge of the Drug Enforcement Administration in the District of Oregon.
Every avenue you can think of is how fentanyl's getting here.
For those of you not familiar with fentanyl, it's a synthetic opioid, significantly stronger than morphine. It's manufactured and tableted out of state or country, then brought back to the community.
A blue tablet, it could be a yellow tablet, it could be an oblong white tablet, but we're finding fentanyl mixed into counterfeit tablets of all shapes and sizes and colors.
For the first time in 6 years, the DEA issued a public safety alert. Fake prescription drugs containing fentanyl are available at an alarming rate. In fact, over the last year, the DEA Seattle Field Division, that includes Washington, Oregon, Idaho, and Alaska, has seen a 275% increase in seizures of counterfeit pills laced with fentanyl.
Demand drives supply, so that's a component of it. Because the drug trafficking organizations are preying on the weak and addicted or weak or naive, that the market, the region has gotten flooded with these fentanyl tabs.
In the last couple of weeks alone, we've learned of several drug busts involving fake pills containing fentanyl. 11,000 pills worth more than $100,000 seized in Clark County. More pills seized during a traffic stop on I-5. 150 counterfeit pills seized at a Southeast Portland apartment, some of it hidden inside a Coke can.
Comes a hidden compartment where a lot of dealers will keep their drugs inside.
As shocking as that may be, there's nothing more disturbing than the news coming out of Klamath County. Investigators there are now saying fentanyl is to blame for the death of a 1.5-year-old little girl over the summer. The mother is now behind bars.
It's terrifying.
Cam Strom says fentanyl is no joke, and it must be avoided at all costs.
If you're seeking pain relief and you're going the route of opioids, is you need to go see a physician. You need to get whatever your pain relief is, you need to get it from a doctor and a pharmacist, not off the street. Getting it off the street exposes you to all kinds of variables that lead to one pill can kill.
Wow, that is just awful. Mike joining us live. And Mike, we just heard that special agent there saying one pill can kill. And that's really sobering when you hear him say that.
You know, it really is. Ashley, Cam Strom tells me that 40% of the pills the DEA labs test contain a lethal dose of fentanyl. That is 4 out of 10 pills. As Strom points out, that's a great batting average, but those numbers are absolutely terrifying if you're using, experimenting, or staving off addiction.